Hello, everyone, and thank you for joining us. My name is Ashley McDermott. I'm with the AIUM, and I'll be your host. As part of our continuing education for healthcare professionals, I am pleased to host this webinar, Intelligent Imaging, AI Transforms Ultrasound, presented by Dr. Martin Chavez. This is a non-CME educational activity in collaboration with Samsung. In this engaging and informative webinar, we delve into the transformative role of artificial intelligence in perinatal ultrasound. From automated fetal measurements to advanced anomaly detection, AI is becoming an essential component in maternal-fetal medicine. Discover how these cutting-edge technologies are being integrated into clinical workflows to enhance diagnostic accuracy and improve patient care. If you have questions for the presenter during this webinar, you may type them into the Q&A box. You will be able to submit questions throughout this webinar, but the presenter will not begin addressing them until he has completed his presentation. This webinar is being recorded, and you will receive a follow-up email within 24 to 48 hours with a link to view the recording. And now I am pleased to present Dr. Chavez.
Good afternoon or good evening, depending where you are in the country. I want to thank AIUM with Samsung for allowing me the ability to share some of the interesting cutting edge technology that we've been integrating into our prenatal care. Okay, so today's title is going to be Intelligent Imaging AI Transform Perinatal Ultrasound. It's already occurring. AI is all around us, and as you probably already are using in some of your systems and some of your labs already, and it's going to become more and more pervasive. And I think it's important that we not only have these type of discussions and presentations, but also help steer utilizing this technology in the best possible manner. What we're going to do is have a couple learning objectives. As Ashley had mentioned, we want to do some core concepts of AI and machine learning. We throw around these terminology a little bit, and I think it's important that we try to standardize when it comes to its utilization in perinatal ultrasound, when it comes to image recognition, segmentation. I'll explain that in a second, as well as automation. We're going to highlight some clinical applications, such as automated biometry measurements, which a lot of us are already integrated, fetal anomaly detection, and workflow optimization. Every day we see, more and more patients, and we want to give the same quality of care to every single patient. And what we want to do is leverage technology to achieve this. We're also going to evaluate some of the benefits and challenges of integrating AI technology or tools into this work environment. Before I start, I want to give a heartfelt thank you to our MFM team at the NYU Langone Hospital Long Island campus. Without their dedication, without their drive, not only for the best medicine we can provide and also great research as well as great teaching, this type of technology couldn't be tested, implemented, and utilized to its most efficient manner. AI is all around us, whether we are ready for it or not. We're already utilizing it. Driving into work today, I used my E-ZPass. That E-ZPass allowed the system to recognize who I was. And even if I didn't have an E-ZPass, it would be high-speed cameras detecting my license plate and being able to, send me a bill directly to my home, so I can pay for my toll, the utilization of the roads in my region. We use smartphones with facial recognition that's implementing AI. We utilize virtual assistants. We have personalized recommendations for streaming platforms. We utilize it for filtering spam emails, customer service chatbots, smart home, navigating apps, personalized product recommendation, text editing and auto recognition, filtering and effects to photos, personalized context, voice to text recognition, In our work environment, we utilize Dragon on a constant basis, whether it's through our EMR or through our ultrasound reporting system. You know, for me personally, I'm not a very good typist, so I utilize it on a regular basis to make sure that all of the information I want to get across to our referring doctors and our patients are very clearly, seen and typed out in the reports. Language translations. When I travel overseas, I utilize AI all the time to help communicate in other places where I don't know their language or they don't know my language. Personalized news feeds. We can customize the amount of information, the type of information that comes across our feeds, whether it's email, whether it's on a cell phone, or other type of communication modalities. And I think, even though we don't think we're implementing it, it's already integrated in our everyday life. One of the great things about working in an environment such as NYU, you really do have access, and you have the depth and breadth of experts from around the world, basically focus on our campus. There's this one individual, Lacoon, who I quote quite often. There's this one quote that I utilize quite a bit and when it comes to these type of talks, and it's, our intelligence is what makes us human, and AI is an extension of that quality. When I first read this, I thought it was a very profound type of statement, because it really does integrate what we know as humans and what we're willing to learn or want to learn and want to extend to the people that we're responsible for taking care of, and also the people we're responsible for teaching, and also our research. If you have a chance, I've included a link to some of his WebExes as well as podcasts, and I think he does have a keen insight into the best integration of this technology and why we should embrace it. And I'm a firm believer that we should. Some of the challenges that our societies are facing, our professional societies, is that trying to keep up with the technology and how to best provide guidelines. And the technology is evolving faster than regulations and ethical discussions can actually try to keep up with. So I think it's important that we participate in these type of discussions, and also make sure that we implement it in the best possible manner, as opposed to having someone else choose that for ourselves, as well as the patients and the systems that we are part of. I'm a firm believer that we should learn from our past, and that we should not forget our past. And the reason I bring this up is because ultrasound in the last several decades truly has changed, but some of it has not. Some of you may know or not know that Tom Brown was basically the inventor of medical ultrasound. And he was an engineer that was working on material integrity evaluation, basically using ultrasound to see if ship hulls had any defects or stresses on them that might affect the integrity of the hull and the safety of that ship. And, by coincidence, the alignment of the stars, he happened to connect with an obstetrician, Dr. Donald, and a physician of University of Glasgow at the time, and they were able to realize that they were able to take ultrasound and utilize it for imaging of a pregnancy. And, from humble beginnings where you would have an individual sitting next to a bath tub-like structure with a membrane over it and sound waves being shot through. And then later on, where they actually felt more comfortable in utilizing the technology for pregnant patients. And by no means is no even close to where the technology is today. But if you think about it, the concept is pretty similar, where you basically had the patient, you had the person operating the system, and you had a probe, and you had some type of monitoring system. Sometimes it was static, sometimes it was real life. And I want you to remember this, because I'm at the very end, I have what I predict is going to be the future, right? So here they use the interface of water or gel to get those images, but I think even that is going to change. not necessarily in my professional lifetime, but definitely the people that we're training now in our fellowships and our residents and our maternal fetal medicine fellowship, all the fellowships that utilize imaging. Maternal fetal medicine is unique is that we have two patients in one. We have one on the outside and one on the inside. And we're basically trying to decode pregnancy through prenatal ultrasound. And, we do fetoscopy here for fetal therapy surgery program. And, as you can see the fetus there moving around, and you can see the umbilical cord, and you can see the face there, and the hand, and the elbow. And I think that, ultrasound is an amazing technology, and a very safe one that allows us to basically look inside without necessarily having to do a fetoscopy, right? Because obviously it's relatively safe, but it's not necessary for all patients, but allows us to get in there and see some information. So we're going to start with some core concepts first. So, we hear the concept all the time about AI, artificial intelligence, and it basically refers to computer systems that mimic human cognitive functions like learning and problem solving. But that's all it's doing, it's mimicking. Now, with machine learning, what you're doing is a subset of AI, which with all the algorithms that learn from data, huge sets of data sets, to make predictions or decisions without being explicitly programmed for every scenario. I think that comment is very interesting because that's what we do as clinicians every day, where we basically, yes, we're trained, and yes, we've seen quite a bit, but sometimes there's things that we have to decipher that we haven't been taught or we haven't learned. And I think that's where machine learning and we as humans are very, very similar when it comes to that, particularly in certain fields, particularly in the medical field. Ultrasound machine learning is applied using supervised learning, where there are models trained on images that have been specifically labeled by people who are very comfortable with interpreting these images. And I think it's important to keep that in mind. I'm going to go a little bit without getting too heavy behind the engineering or the science behind it, about some of the systems that we use, right? AI systems analyze raw ultrasound images to identify anatomical structures, whether they're fetal brain or spine or heart. Particularly, there's a technology that it refers to that's used quite a bit in imaging recognition. It's called convolution on neural networks. It's a fancy way of saying that we basically break down those images, and we analyze those and see what the most likely result or interpretation of that image is. We have segmentation, which involves outlining structures within the image, and I'll give you an example of that as well. And deep learning algorithms, where segmentation reasons of interest for further management or diagnosis. So when we look at these cognitive, or the CNNs, these convolutional neural networks, it's basically taking an image. I'm using a cat to simplify things, and it takes a image and it breaks it down into 3x3 segments, and then it breaks it down even further. So saying that this is a edge and it appears to be an ear, and then it takes this and then analyzes it, and then it says 92.8% of the time when you see these type of images, it's consistent with a cat. It could be a dog, but it's most likely consistent with a cat. And I'm using cat and dog as a basic representation, but imagine utilizing this for, instead of a cat, for normal, and instead of a dog, for abnormal. And it's a very simplified way of us being able to teach these algorithms or these models to allow us to get them to recognize much faster than the human eye or the human brain can do. And I'll give you examples of some of the things that we've tested out and we're starting to implement in our union. The segmentation involves a more simplistic approach, where we're just basically outlining, outline of a structure or even inside of a structure. And this is a very simplistic, representation of it. There all can be much more complex segmentation of areas, and I'll show you that in some of the examples I have. And one of the things that I do tell people who are interested in this type of technology implementation, particularly in prenatal ultrasound is that, yes, look in our typical journals, obstetrics and maternal fetal medicine, and also radiology and imaging. But in addition to that, and I find this a very a wonderful resource, is don't forget the biomedical engineering and health informatics journals, as well as digital health and emerging platforms. One of my favorites, and they also have podcasts related to this, is the New England Journal of Medicine AI. And they really, really do have the depth and breadth of a lot of the fields, not just necessarily prenatal ultrasound, but they have mammography or they have radiology, looking at chest X-ray, CTs, and the list goes on and on. So basically, the reason I share these two slides is because I think it's important to realize that don't rely on just our traditional medical journals when it comes to investigating or looking for options for research or looking for information that might be relevant to your particular field. When I look at this technology, I break it down into three categories, right? Workflow simplification, a better imaging quality, and support for clinical decision, right? As a division director, I wear multiple hats, right? Obviously, as a clinician, as a manager, as well as a business person. And when I look at these technologies, I want to make sure that, yes, I want to improve the clinical portion of what I do on a regular basis, but I also want to improve from a business point of view how to best maximize the number of team members I have. We have a very robust team. We have 10 maternal fetal medicine specialists. We have 25 perinatal sonographers. We have 13 sites. We do over 29,000 ultrasounds any given year. But the reality of it is I have to make sure as the division director that I optimize the equipment that we invest in. Just because it's new doesn't necessarily mean that it's going to be applicable to us. We want to look at things like routine tasks, reduce keystrokes, reduce scan time. Is it repeatable? And am I reducing the intra or inter observer variability? One of the things that I'm very, very sensitive to because of our team members is that, particularly with repetitive motion, they do have a higher incidence of injury. And what we're trying to do is minimize and hopefully one day totally eliminate that. And what we want to do is also utilize AI to improve not only what we typically do to try to make sure that we improve image resolution and quality, but also making sure that we do it almost like in automatically without necessarily having to take the time and energy to do that for every single image. So imagine an AI being able to identify and saying, okay, this is going to be brain. So I need to, make sure I set my resolution and depth penetration to a certain level. The other thing is that we want to also utilize this technology almost like a second opinion or build up our confidence. And that confidence level can be across the spectrum, whether you're just starting in this field or you've been a seasoned veteran where you have decades of experience. Because I think it's important to realize that, just like my colleague had mentioned before, AI is, not a substitute for us, but it enhances our ability as humans to really gather as much information as possible. What I want to do next is share some recent studies in AI and prenatal ultrasound. And, some of the journals I had mentioned before, I chose them because I think they were relevant, and I think because they're relatively new, and I think they emphasize some of the important concepts of why this is important. The first article I'd like to share is from New England Journal of Medicine AI, and it's utilized AI to assist fetal anomaly ultrasound scans, a randomized control trial, right? We all love RCTs. I think that's, we consider the gold standard. And they did something pretty neat and pretty extensive, right? They took 78 patients, participants, and a third of them had some type of congenital heart disease or anomaly, and 58 sonographers, which was into itself is a task, right? Getting all these sonographers as well as these patients together. And I think the reason they focus on congenital heart disease is that we have such a wide spectrum of a detection rate, from as low as to 30% to as high as 97% 5 or higher percent, depending on who's scanning the patient and what the parameters are for that patient. But this particular study would, jumping to the conclusion a little bit, AI assisted in routine fetal anomaly scans, resulting in significant time savings. And when you save time, that does a couple of things. From a business perspective, right? It allows you to be efficient in the utilization of your resources, whether it's room, whether it's the time that you have any given day to scan patients. But when you reduce time, you also reduce the ability to have less likely or reduce the chance of having injury because of that repetitive motion. And the other thing, and sonographer, it reduced sonographer cognitive load. And I'll tell you what that means. And that cognitive load applies to any clinician, or whether it's a sonographer or whether it's a doctor who's interpreting or performing some of these scans as well. And what they did is they implemented a AI system within the system. They had an extra screen. There's two flavors as to how AI is implemented in perinatal sonography. I'm going to tell you after I share the both modalities what I tend to favor. One is while the patient is being scanned, and one is after the patient is being scanned. That's in the reporting system. And there's pluses to minuses to both, but I personally think that there is benefit to having it what I've referred to as the front line, right, where the patient is being scanned for a couple of reasons. One, it actually helps with minimizing the scan time, but more importantly, I think it really helps with the training of individuals and also the maintaining of skills of individuals, regardless of whether you're very seasoned or just starting in your career doing perinatal sonography. This particular study, they looked at anatomical measurements that we typically get, as well as some of cardiac views, which were used to detect. And interestingly enough, and not a surprise, right? The scanning time in minutes was actually pretty drastically reduced for AI, right? It makes sense because they were utilizing AI to help identify the images that they were trying to capture. Interestingly enough, the reporting wasn't as different. And I think there's a couple of reasons for that, and I'll share that. And I think, and this is for a different discussion and a different topic, but I really think that eventually AI will very much help assist us in creating these reports. I'm not talking about what we have now, where the reporting systems capture through DICOM the measurements and the images. I'm talking about actually the AI evaluating the images, evaluating the measurements, and start drafting and crafting the first version of the report, where if it's growth restriction, or there is a variation in some of the measurements of the biometry, where that's already being put into the reports without it not having to be manually placed in by our teams. The cognitive load is they use two scales. There was a Nassau scale, and then there was a PASS scale. But more importantly, when you looked at the AI assisted scan, right, which is in that grayish area versus the tan, you saw that there was a cognitive load. And the reason that's important is because, think about it, we are very good at it, particularly in ultrasound, to multitask, right? We're making sure that the patient's okay. We're capturing images. We're making sure we're making adjustments and everything else. But imagine being able to have less of those distractions. And I don't want to say the distractions, but now we can pay more closer attention, not only to the patient, but the images and what the information that those images are giving us. And when we do see a concern, now we can focus more on capturing better or more images of that concern, as opposed to having to circle back. So I think the cognitive load component of it is definitely something that we will continue to monitor, not only in the research that's coming out, but also in our unit as well, because I think it makes for a better experience for the technician or perinatal sonographers, and also for the patient as well. In this particular study, when we looked at the sensitivity and specificity, and you can see that there was an improvement of manual versus assisted. In addition to that, the duration of the scan, we're talking about almost half the duration. That's pretty significant, And I once had a sonographer said, okay, so we're reducing the time it takes us, so you're gonna, increase our load by twice as much. And I said, yes, that is a potential, but what we want to do is have the ability to almost have like these more mini breaks in between the scans, so allow a sonographer to recharge and making sure that the injury that might occur in longer scans is actually reduced. So it's not just about cramming in more patients. It's actually, yes, we want to increase the throughput. Yes, we want to make sure we get the patient in and out as efficiently and in as short a time as possible. But more importantly is to give the sonographer a break, or the doctor a break in between scans. And that's more feasible when you do have that cushion in between that. We all know, and, we see this, and this has been reported in, multiple societies, and, what the recommendations are scan time and everything else. But going back, and once again, not to elaborate too much on this, is the report creation time. If we can not only reduce this, but also reduce this, now we're really making progress in getting that patient the information as quickly and as accurately as possible for that clinician to have that, as well as our teams who are acquiring the information as they go along. The next study I wanted to look at was done it seems like, in the world of AI, it seems like light years away, which was 4 years ago. But what was interesting about this, it was exploring new paradigm for fetal anomaly ultrasound, artificial intelligence in real time. And the reason I bring this up is because this is here already. And this particular study, they showed that separating freehand scanning from image capturing and measurement resulted in faster scan and altered our workflow. And I'll show you some of the examples that we've already started looking at. And what I want to do in the near future, start investing in these type of technologies that will allow us to really start implementing this. The next study is probably where I think that it's really going to be a seismic shift as to how we analyze these images that we're capturing. And this is in prenatal diagnosis, and this is a recent study. This was actually the beginning of this year, so it's not that long ago, only a couple of months ago. And what they did is they video clip extraction of ultrasounds, and AI basically took the best of the images and extracted it out. So imagine you're getting a stream of ultrasound video, and AI extracted the images that really highlighted that. And in this particular study, they used the same patient, and the patient was had two scans, right? It had a standardized manual scan, and then it had another scan using AI assisted. With the manual scan, they selected images, and then they sent that to expert second review. But with the AI assisted scan, they had AI acquired video clips captured. And I think this is where it's going to make a big difference. And I have a vision, and I'll share my vision with you, where basically it's going to be a automated process where it's the patient is scanned a couple sweeps and the scan is over, and AI is already going to start analyzing this. And the reason I think this is important, if you look at this, the manual scan versus the scan that was done with AI acquired clips, you see that there's video clips always improve the sensitivity and specificity. Not surprised, right? Because you're not just dealing with a static image. We know that from experience that, particularly when we're looking at organs such as the heart, that we get better results and we get better evaluation of that organ when we do have cine clips built in. Now, this is the exact same outcome of that study, but it's in a graphical format. Imagine the sweet spot being the top left here, right? But when you do the manual scan, and you had the video clips built into it, right? You see that they're at the top of that and closest to the left, and you sacrifice a little bit when it comes to sensitivity and comes down, but maintain your specificity. So this is a perfect example why it's important not only for us but for AI to incorporate these video clips, because when we do a cine loop, there's things that we as human and our human eye can capture, but there are things, and I'll show you some examples of that. There are things that AI can capture a lot better. And in fact, when I've looked at some of these technologies, I've actually had to slow down the system for me to realize how sensitive and specific these systems are when it is capturing it. The evolution of these is being driven by a couple of things, right? We need to be fast, right? The reality is that we're getting reimbursed less per scan because of insurance challenges, and we want to make sure we still maintain the same level of quality that we want for our patients. We need to be accurate, and we need to be able to communicate with our patients and colleagues as fast as possible. We also know that our patients literally get their reports as we sign off on it. I have patients who, before I come into the room, I've evaluated the images and I've signed it, and they're reading their reports before I even get into their room and answer their questions. So it's real time. Most institutions are releasing the imaging as well as the reports in near real time for our patients when it comes to imaging. We need tools that will allow us to achieve this, right? To keep up with the pace where we want. It's almost like we want, I have this hypothetical image in my mind where I have a virtual assistant to assist not only our perinatal sonographer, but also us as we evaluate the images and, help guiding us through this, right? So I envision a cutting edge ultrasound system with an integrated AI-powered virtual assistants, whether it's capturing those images, identifying for me what the normals are and everything else. So what I want to do next, I've shared some studies and everything else, but I want to share is what some of the things that we're doing in our ultrasound unit. But before I do that, I want to give you an example of how I think AI has advanced so much. And if you want to try this on your own and with any image that you want, I'm just going to use an image of a placenta previa on the cervical length. And what I did, and I just happened to use this particular AI system. And you can do this. Obviously, it's de-identified. You don't want any patient information. We have guidelines in our system. This was not one of our patients. I utilized this from, our archival images that I had, for educational purposes. And what I did was I downloaded the image, de-identified, as I mentioned before, and tell me about this transvaginal ultrasound and any concerns. And of course, it even picked up that I was not paying attention to my typing and corrected for the placenta, right? I gave it some guidance, right? You don't want to be just saying, tell me what this is, right? If you give guidance, just like if you had a medical student or a resident or a fellow, and just by that one image, and I don't know if you can see on the screen, I'm going to read it to you. It's basically telling you about multiple irregular vessels visualized in the lower uterine segment, abnormal lacuno-vascular pattern, color Doppler signals showing turbulent blood flow pattern, loss of clear tissue planes. From that single image, and I had not trained the system prior to this, and I had not given it other images to compare. But now the clinical implications, right? I told it, what do you think this means? Refer to a maternal-fetal medicine specialist. Detailed mapping for potential position and invasion of depth. Delivery plan at a tertiary care center. Possible need for cesarean hysterectomy. Multidisciplinary surgical involvement. This system already knew from that single image, placental invasion was already a concern, right? So think about, we have courses, we have, textbooks, we have, manuscripts going into depth and coming out with guidelines and everything else. But imagine having a system which already is alerting this to us as we're scanning the patient in real time. And this was just just an example of me putting an image on there, but imagine this being able to be done on front line, as I had mentioned before. We already have these, symptoms and systems in place in our maternal fetal medicine units where it measures already. We just stop and everything else, and we know the accuracy already when we include or not include images with some shadowing, and when we include images with that are non-reliable, or detection rates, shoot through the roof, approaching 99+%. And I think that's an important thing to remember, because this is just the tip of the iceberg. We're already utilizing it for crown rump length. We're utilizing for labeling of annotation, auto annotations, and everything else. And this is not just for the heart. We're utilizing this already for the CNS system in the fetus, where we're able to get the traditional views, and then those traditional views are sliced and diced into giving us even more planes for fetal brain diagnosis, or to clear normal anatomy as well as to abnormal anatomy as well. And this is, one of the challenges are when we look at I'm using the tip of the nose and the lips, because that sometimes can be a challenge, not only for sonographers, for AI systems to detect. But when you utilize auto detection or auto annotations, right, we've already seen a drastic improvement in our time throughput through scans, whether it's something as straightforward as tip of the nose and lips, but also cardiac as well. We're saving a huge chunk of time, because we're not labeling everything manually and putting arrows onto it and everything else. So I think it's important that we do save time when we can. And this, no one's touching anything up there because they're done. And as you can see, at a fraction of the time. The other thing is that when we do look at when we do look at these systems, and we want to make sure that these systems are evaluating, now this is a perfect example of how it's evaluating and segmenting these images in real time. And as you can see, it's collecting these images as it goes along, and then it can also, decide what it considers, appropriate images, good or ambiguous. And you can have a manual override with a lot of these systems. So this way, it actually can help detect the images that it classifies, but we can override it. And once we get more and more comfortable with this, we allow the system to reduce our cognitive load, what I had mentioned before, and really focus on what's important, right? Is the the vein going in one direction as opposed to another direction in the liver. And this is a perfect example of how, as we're scanning, it's not only creating that checkoff list, which a lot of systems have already, but it can do it automatically. And then it's also capturing those images, and actually it captures those images, and if we capture the same images but it's better quality, it'll select that image, and we can either decide to use what it considers the better image, or we can let the system decide as we get more comfortable with it. And this is just taking some sweeps, and as we're taking sweeps, we're already collecting a dozen images with labels on them already. So this way we can focus to make sure that the situs is okay or the fluid looks okay, but the system can assist with that as well. And in our unit, when we look at these systems and we see a difference when these virtual assistants are on versus off, and here it's actually running. And this is it's not that it's frozen in time, and I'm not pausing and collecting images. The system is doing it itself and actually collecting the images as that red arrow is indicating. And not only for the traditional views, right, for the biometry and everything else, but also it's doing that for heart views. And instead of manually having to label it and almost taking a whole minute to label it, it's automatically doing it. And it's doing it at a speed that's absolutely incredible. And the accuracy, it's been shown, and not only with us, but also been shown and in other institutions, that it's extremely accurate. Here's a perfect example as to why we have to actually slow down the system for us to actually appreciate what it's doing. Because if we just did the scan, we wouldn't be able to catch it with our regular eyes. And we need to be able to allow the system to slow down enough to get these images. And whether it's getting the area within in different portions of the cardiac cycle, or labeling, it's really doing it in a time frame. And this is actually slow for the system. And this is the only reason I'm sharing this, so this way I can see it and I can share it with the audience that I'm sharing this with it. And it goes beyond not just the labeling and everything else. It goes about being able to detect different type of tissues. And I'm going to use the pregnancy as a perfect example. Whether it's in the first trimester or in the second trimester, where now I'm able to capture the different portions of a 3D scan, and it automatically detects whether it's uterus, whether it's fetus, whether it's placenta, and segment the different portions of a multiple gestation pregnancy. And this is from our lab, where we're able to distinguish between and get rid of all these different layers depending on what I want to see and what I want to focus on. Here's a nice video showing this, where we took a scan of an 18-week fetus, and then I decided that I want to get rid of the uterus first, and that'll be in green. Okay, and then after that I decided I want to get the fluid, that would be in white, and I want to get rid of the placenta, that'll be in purple, and I see the umbilical cord in blue there, I want to get rid of that, and then I want to rotate the fetus and then just focus on that. But I can even segment portions of the fetus. So if I wanted to just focus on certain parts of the fetus, so for example, the torso, I can. And this is where I think the ability to now, instead of having to worry about having to do this manually, I can do this automatically, and then focus and go in there in utilizing the multiplanar view or 3D view, where I can take these volumes and actually start analyzing in much more detailed views. And these are some of the white papers that we reference when we started to decide to analyze this in our ultrasound unit, and how we wanted to implement it. And we got very, very similar numbers to these white papers. And obviously I use peer-reviewed papers as well. But I think the white papers do have certain value to them. So this way I can see how close to the references that they're looking at. And what we're doing is, what we're going to start looking at next is where we actually are just going to take these sweeps and let the AI system basically identify and label everything, and then compare that to our traditional scans. And I think this is where it's going to really start changing the nature of what we consider a routine prenatal scan. And once again, this is slowing down, so this way we can visualize to see what the system is doing. And as we go through the heart, you can actually see it labeling and identifying all the structures of the heart. And this is going to serve a couple of different important purposes. And one of them is going to be to allow even further enhancement of our remote patient ultrasounds, because not every single patient wants to travel, or they want to stay with their primary OB, and also to allocate the skill and expertise that we may have, whether it's within our institution, whether it's within our system, or within our region, or within our country, or worldwide. worldwide and automation. I have this image which I have up one day where the patient comes in and they lay down, after they've been counseled, and in a matter of a couple of minutes, they get a couple of sweeps, and AI will be able to segment, evaluate, and score the images that it required, probably in less than, a 10 to 15, 15-minute scan, if not even less than that. The other thing that I think it's important to realize, where I think it's going to really be important to utilize this type of technology, right? The Gates Foundation is a philanthropy organization where it's trying to really give access to patients worldwide. 800, the number of women who die every day for preventable causes in pregnancy. I think that's so important. 50% of patients, in certain economic scenarios, are not receiving any ultrasound during their pregnancy. Number of patients lacking access to medical ultrasound, 4.7 billion. That's a huge number. But imagine if we can, take a portable ultrasound probe, plug it into any smart device such as a phone, do a couple of sweeps, and be able to get automation of information of that pregnancy, right? Without any training, without any additional access, to care. I think that's going to be a game changer across the board. Not only worldwide, but also access to care across, across our country, and obviously worldwide. But I think it really is going to be a game changer and make a huge difference. When it comes to that. I want to give a shout out to Samsung, not only for helping with AIUM support this, but I also want to I worked with other colleagues in coming up with how AI is really changing the landscape, whether it's women's health, GYN scan, or artificial intelligence and prenatal scan. I want to give a shout out to our first year fellow, Dr. Julia Kim, who helped me on this project. And the reason I was excited to work with her on this project, because she's our future, right? She's, the next generation who's going to not only embrace this technology, this is how they're going to be trained, and this is how they're going to utilize this technology. So I have the link up there. If you're, hopefully you'll go visit. I think it's a nice way to see a sneak peek into the future. And speaking of sneaking peek into the future, I can imagine one day, right? And of course, I generated this utilizing AI. It's a technology called Sora and OpenAI. But having non-contact air-coupled ultrasound exam, and they're going to say, "What are you talking about? You need gel, you need this, you need this." Non-contact air-coupled ultrasound is already being utilized in industry to inspect material. Does that sound familiar? That sounds like how medical ultrasound started, right? Remember, they were using it to examine metal and other materials to make sure it was, the integrity was correct. Well, non-contact air-coupled ultrasound is already being utilized in industry. And I can foresee just a matter of time where, the need for having direct contact on the abdomen is going to be considered antiquated or a quaint method. Just like you smiled when you looked at those black and white images and you saw all those big machineries, or that young man standing in that tub of fluid to get ultrasound images of the of his anatomy. So I look forward to the future. Hopefully I gave you a little bit of a glimpse, and a little bit of a spark to of what the future holds for us. And with that, I'd like to end, so this way we do have a little bit of time for some questions and answers. And if you want to contact me, this is my email. I'll gladly have have the ability to either collaborate or share some of our experience, and maybe you can share some of your experience with our team. So I would love to hear that. So I'm going to go into the chat, and I hear a couple of things People saying wow, which is nice to hear. And I hear one of my colleagues up in Boston, this will have tremendous potential for telemedicine with remote scans of 100%. Another comment I hear about sonographers may find this as threat of being replaced by robots. And, I think that everything evolved. I think that, one field might be, changing, but another field opens up. Imagine having the ability to be part of this process. I think it's important, particularly in a field like medicine, that we do embrace this type of technology. I see another comment about are jobs in danger? No, I truly don't believe so. But what I do think is that the skills that our perinatal sonographers and our teams have will be enhanced. And imagine not having to worry about your arm feeling so fatigued that you can barely move, and where you can actually focus, right? That cognitive load that we've spoken about, and focus on the concern that might arise. Right? As we know, the majority of pregnancies are healthy and normal, that they don't need us. But imagine being able to focus on pregnancies that truly do need our care. And I agree that our jobs are not in danger. I'm excited to what the next wave of this technology is going to bring into our field, and how it's going to enhance our field and allow us to focus on patients that truly need of you know need our services and need our focus. And this way we can help those patients the most, because the reality is that pregnancy is a normal healthy part of life, but some pregnancies, that 3 to 5% that do need our help, right, are going to be have our focus on that. So I'm looking at our webinar chat, and although we're aware of this technology and its hold, um, and I think it's also important that we participate in this. When people ask me, "Oh, are you concerned that this technology is going to replace you?" I said, you know what? Anything has the potential of replacing us, but I think it's important that if we participate in the process of evaluation, if we participate in the process of being part of integration of this into our field, we will not only have better integration, but also have better opportunity to integrate it correctly. So your last video, touchless AI scanning, that was just my vision of what's in the future. Industry is already utilizing touchless ultrasound to integrate material, and just like we started off on that in medical ultrasound, I can imagine one day this being integrated into medical technology, ultrasound technology as well. And I'm just looking at some of the questions there. I'm working with it, and images we need to be about some for AI to recognize it. Yes, there is room for improvement. That's why it's not going to replace us, but the more we work with it, the better we get and the better it gets. Another comment was about the replacement of an actual skill sonographer. It will enhance our skills. And also I think it will allow our junior, sonographers or faculty members or, physicians to better utilize the technology faster. Hopefully position to detect, measure, and annotate. And I think that one of the comments is that, the images don't necessarily have to be in that perfect position, because AI can detect what we are not able to see with the naked eye. And I agree with that. So I think I've answered the majority of the comments, and in the webinar chat, I hopefully have not missed anyone. If I have, I apologize, but I'm trying to do my best. One of the comments about the challenges of not being able to create a wireless probe yet. And I think this probably will leapfrog that technology because remember, this is all wired. You know, if you've ever been able to been in a Amazon warehouse and you see the automation that take place and how efficient they are, it's amazing to me how we have not emphasized or leveraged some of this technology into the medical field yet. So it'll be interesting to see what the next few months and the next few years. This is not decades away. My personal opinion is that it is much closer than that, and it's probably going to be starting to be implemented. We already see it in our systems. In the last few years, if you've invested in some of these systems, you've seen that they're already integrating it. And this last year or two, you've seen a lot of technology come out. And I think that it's important to, have discussion with the companies that you, partner with to make sure that you're utilizing the technology to its fullest. So, at this point, I don't see any more questions or comments coming across, and I appreciate everyone's comments as well as attention during the presentation. And I think I saw one more patient. Okay. Patients won't be thrilled with a robot and a 10-minute scan. The exam is their opportunity to watch and bond with their babies. That's an interesting comment, right? I would tell you that patients get impatient with us when they scan, right? But imagine being able to send them with an image that they're able to manipulate at home to see their baby in any way that they want. I think that's going to be probably a closer norm. If someone told me even a few years back that our patients would receive every single image and have the ability to look at their images at will, I would say I don't know if they would want that, but our patients embrace that. First of all, it's federally mandated that patients have access to all of their records, images included, and I think that this is just going to enhance our ability to provide that with our patients. And one of the last comments is the primary purpose to increase throughput. That's only a small fraction of it. I think it's also helpful to improve accuracy and reduce injury and fatigue to our teams, but also allow us to focus on and capturing the images that allow us to be as accurate as possible diagnostically, as well as making sure we get the patient through the exam as quickly and as safely as possible. And I think we're, at our 57-minute mark. I think we've covered quite a bit. And I thank everyone, AIUM as well as Samsung, for allowing me to share with this. And in the near future, we do have some interesting information coming out. And I look forward to sharing that with my colleagues out there and everyone, hopefully has my email at this point, and I would like to continue the dialogue with anyone who's interested in this. Thank you so much. I appreciate everyone's time and attention and investment in our future. Thank you.
Thank you, Dr. Chavez. And again, thank you to Samsung for partnering with us to make this webinar possible. And a big thanks to all of you for joining us. As a reminder, you will receive an email within 24 to 48 hours with a link to review the recording. And this will be posted on the AIUM website. Lastly, we leave this webinar be prompt to complete a brief survey. We'd appreciate any feedback you would provide. We will use that to help us to plan our future educational offerings. And with that being said, we will close out this webinar. And thank you again for joining us and have a great rest of your day.